Around the world, uncounted numbers of people are detained in public and private hospitals for non-payment of hospital bills, despite the fact that hospital detention is seen as both a human rights violation and inconsistent with efforts towards universal health coverage. Let's narrow the situation to our own country, Ghana, because such cases have become one too many. Imagine being detained at a health facility for weeks due to your inability to settle your medical bills after treatment. Well, that is the story of 14-year-old Mary Lamte and 36-year-old Ikua Ditua, who have been detained after undergoing surgeries. These two are just few of many grappling with similar circumstances in Ghana.
Her bloodshot eyes are proof of her endless tears. The 14-year-old has been detained at the Greater Accra Regional Hospital after she had a surgery. She's been here for a month. Mary Lamte was rushed to this hospital in April after suffering severe abdominal pains. Doctors later diagnosed it to be a complicated appendicitis. Mary had a surgery a day after she was admitted and was discharged in May. But she had to be kept at the facility because her parents couldn't pay her bills. She owes the hospital about 6,000 cedis. Her national health insurance card could not absorb part of the bills because it had expired. Mary's mother had to also stay at the hospital while she was detained. She has left her other children, including a 1-year-old son, at home in Dansuman Begbeise, which is far away from this hospital.
She has been operated on and brought back to the ward. We cannot afford the 6,000 Ghana cedis bill to get her discharged. We are hoping to get a good Samaritan to come to our aid.
Settling the hospital bill is not the only challenge here. Mary and her mother don't even have money to buy food.
If not for a stranger, we wouldn't have had a meal to eat yesterday. I don't have a penny.
From the Greater Accra Regional Hospital, we went to Mary's home in Dansuman Begbeise. We met Mary's father, Ernest. He had just returned from fishing. He had to leave the 4 children all by themselves to go fishing at dawn, so he could send 20 cedis to the daughter and wife at the hospital. The family of 7 lives in this single room.
I do not work with fishing equipment. I do everything with my hands. I make between 30 to 40 Ghana cedis a day. I haven't gone fishing for about a week because of the kids. I have no savings, and whatever I make, I send to them.
I get 50, 30. I don't know sure money. Yeah, me to me come back when I see a friend. I will be our first no one. Now my saying said 20 Ghana, not 30 Ghana. Now my saying no moon. I mean, there's kind of a build houses.
The scene here paints a picture of the real situation this family is in. It is not surprising that Mary's parents could not pay the 6,000 cedis hospital bill for her to be allowed to leave the hospital.
We need help. Even if it's a loan we will have to pay back over time, we will appreciate it.
This situation is not peculiar to Mary Lamte. Back at the Greater Accra Regional Hospital, in a room beside Mary's ward, Ekuaditua has also been detained here for a week. She was admitted and treated for hernia in May. She has to pay about 4,000 cedis before the hospital will allow her go home. But she says her husband has abandoned her because he cannot pay the bill.
I have been here for long. My husband took off to find money to pay the bills, but has since not returned and made no contact as well.
Mary and Ekua are just two of the many people detained in hospitals because they cannot pay their bills, something you can refer to as hospital prisoners. Many of such victims, including new mothers, are forced to sleep on the floor at some hospitals. Detention of patients in hospitals over unpaid medical bills has become very common. Hospital officials justify this practice on the basis that once they release patients, it becomes difficult to follow up to retrieve their money. Hospital detention is also common in countries that have major gaps in their healthcare funding systems and that have not implemented health insurance. Health facilities receive too little and unreliable state funding for their services. The hospitals are therefore largely dependent on out-of-pocket payments. Last year, the Greater Accra Regional Hospital lost a total of over 160,000 cedis to 88 patients who absconded, according to officials.
Some, during the course of treatment, they are not completed, but they choose to abscond. Some too, after treatment, maybe they are waiting for their bills to be cleared. Then, one reason or the other, they run away from the ward. So, as at 2021, the total abscondees that we had was 88 people, and their total bill amounted to 160,746.62 Ghana cedis.
And that's not all. According to the social welfare departments at the facility, the trend is worsening.
We have about 230 patients who were granted an undertaking. Their total amount was 313,153.5 Ghana cedis. The amount we were able to recoup was 31,785.49 Ghana cedis. We have a total of 151 cases, patients that their total bills were waived, and this amounted to 346,518.70 Ghana cedis. For those patients that we declared paupers, their number is 59 people, and their total amount at the end of the discharge was 200,202.50 Ghana cedis.
Studies show hospital detention of defaulting patients in countries such as Nigeria, Kenya, Zimbabwe, Liberia, Uganda, Cameroon, Democratic Republic of Congo, India, and Indonesia. In one case, 400 inmates were reported in a single hospital in Kenya. In May, the Asante-Hene Otumfuose Tutu II's Foundation paid 30,000 cedis to free 26 pregnant women who delivered in Komfanochi Teaching Hospital and were under detention for their inability to pay their medical bills. President of the Ghana Registered Nurses and Midwives Association, Perpetual Oforiampofo, says the situation exposes the gaps in Ghana's health system.
In actual fact, when you look at the entirety of the health system and Ghana as a sovereign nation, what is the policy in place to help citizens access health care without too much burden? The National Health Insurance Scheme that we have, the various conditions it covers, and the kind of medications that it provides and the investigations that it covers. We are all aware it is in these documents, but the truth of the matter is that it is not even effective. And people still have to take money out of their pockets to cover the cost of these. not to talk about the conditions that are not covered by the National Health Insurance Scheme. So there's a whole lot of burden on the citizens of Ghana. And if you say that somebody is not able to pay for the services and therefore is being contained, we have a responsibility as a nation to ensure that these things don't happen. The most important thing is to have a stronger National Health Insurance Scheme that can cover the cost of treatment of majority of conditions so that Ghanaians can have better health care.
According to the World Health Organization, as a first measure, hospitals could offer the option of installment payments for certain patients after discharge. However, some analysts say this is not a feasible option for people below the poverty line. They believe paying hospital bills for those who cannot afford would only drive them further into poverty. Ghana is still yet to find its way around dealing with the situation of hospital prisoners. For GHOneNews, Evelyn Araba Edu reporting.
Now, the CEO of the National Health Insurance Authority, Dr. Bernard Okoboy, has encouraged every Ghanaian to enroll onto the National Health Insurance Scheme to avoid being stranded at the hospital. Speaking on GH3, he called on citizens to take health seriously by getting enrolled onto the scheme.
All the basic conditions are covered by Ghana's health insurance. If you come to surgical procedures in children, appendicitis in adults, they are covered by health insurance. Hernia, a common procedure covered by health insurance. If you come to gynecological procedures, ectopic surgery is covered by health insurance. If you come to major surgery, procedures like laparotomy, opening your abdomen to do some surgery because you have some bad typhoid perforation, all is covered by health insurance. Sometimes some of the laboratory investigations which are covered by insurance, some of the hospitals will say, oh, we don't have the reagents. When we spoke to them, the truth, what they told us was that, okay, sometimes the cost of buying the reagents in the hospitals, compared to what we pay them, they make some losses. So, like I said, we've reviewed our payments and want to increase it. But guess what? Even if you are made to go and pay for labs, for someone who has insurance, your cesarean section will be paid for by health insurance. Your admission will be paid for. Your food will be paid for. You might be asked to pay 200 cedis at the end of the day when you have health insurance. But guess what? Your sister who came with no health insurance, like the lady you showed, will not be asked to pay 200. He will pay about 3,000 or 4,000 because his surgery, his admission, his food, all must be borne by the person. So we are not perfect. We are working towards 100% cover, zero charges. But for now, please, what I tell everybody, get the card because the card takes you out of a lot of trouble.
Right.